My name's Stuart Rutland. I'm a paramedic, a registered paramedic, and I currently work clinically in primary care for 2 days a week, and I work 3 days a week for Health Education England as a clinical fellow. After I qualified as a paramedic, I imagined that I would spend probably the majority of my career working for an ambulance trust responding to 999 calls. But actually, more latterly, I think there's been an awful lot of opportunities for paramedics specifically to develop and go into other roles, which is incredibly encouraging really, because I think the 999 environment, the emergency environment, is very stressful for people, and there's quite a high burnout and attrition rate for paramedics. It's not been easy because I think there's always the perception of the paramedic as somebody who works in an ambulance and just responds to 999 calls, but the reality very much is that you're seeing paramedics now, and other allied health professions actually, in primary care, in walk-in centres, in urgent care centres, in A&E departments. Clinically, I work in primary care, and that means I work in a GP surgery, and I'll see patients every 15 minutes and see them for on-day urgent type things and ongoing care. It's taken me quite a while to get to that, and I work within quite a tight and close team of GPs, nurses, other allied health professions. When I started in education about 6 years ago, I felt very much that I was a jobbing practitioner. I worked at quite a high level, and I thought, I need to do that other thing or that next thing. And for me, education seemed quite natural. I was probably a bit naive when I initially started, because I did feel that it was me standing in front of people and saying, look, you need to do what I do. And that was a very big and steep learning curve for me, because actually it was about that journey, and it was about allowing people the space, if you like, to learn. And sometimes what comes with that is doing less, or the perception that you're doing less rather than more. And I think that's an acquired skill, really. I'm about to start a new role. I'm about to move away from both education and primary care and work in A&E. It's a very exciting and challenging role. It's quite a new role as well, but I just think it's another example of how allied health professions are diversifying and they're given these opportunities. I can certainly think of a time 10, 15 years ago when that wouldn't have been available to me. For me, I think the key to successfully moving on within my career was seizing on opportunities, is certainly recognising opportunities and seizing on opportunities. There was always something about changing people's perceptions for me, and you can only, in my experience, do that quite gently. And you certainly have to lead by example, but you have to show by example as well. And I found that as a paramedic, people would quite naturally say, well, actually, you can't work in this environment because you're all about pre-hospital care. But sometimes it was about connecting with that person and just saying, well, let's try. I think what I would say to AHPs is that no matter what stage you are in your career, no matter how much you feel you're tied to one set of skills, one group of patients, that there are always opportunities to develop. I can absolutely assure you there are groups of like-minded people out there, networks of like-minded people out there, medical professionals, nursing professionals, allied healthcare professionals, who will help you on that journey. Feel gently, tiptoe gently. Sometimes the cracks in the ice will creak and you'll feel a little bit anxious, but that's okay, because you just need to move forward, I think.